Hi everyone. Today we're going to talk about point-in-time counts in Canada, their history, how we currently know them, and the future possibilities for the evolution of the point-in-time count. A national working group has been convened to help shape the future of PIT counts, and we want your input on how to improve them as well. I'd be happy to take suggestions at the end of the presentation. I'll start with a quick overview of the presentation. First, I'll describe what a PIT count is, and I'll give a very abbreviated history of the nationally coordinated count in Canada. Then I'll speak about the present PIT counts as we now know them, and PIT counts in the context of COVID-19. Then we'll explore the strengths and limitations of PIT counts, and finally we'll talk about some possibilities for the future. So what is a PIT count? It's helpful to think of it as two separate endeavors: an enumeration and a survey. These are really two distinct pieces. The enumeration is a count of how many people experience homelessness in a community on a given night. This includes folks staying in emergency shelters, transitional housing programs, or outdoors in parks, on streets, in vehicles, or abandoned buildings. Many communities also include those who are spending the night in health and correctional facilities, who otherwise do not have a home. The second part of a PIT count is the survey. The survey collects information from clients on demographics and service needs. The survey is anonymous. It includes questions on age of first homeless experience, racial identity, immigration, migration, experience with child welfare, health challenges, sources of income, sexual orientation and gender identity, and more. Not every individual who's enumerated will complete a survey. And conversely, not every individual who is surveyed may be enumerated. So you might wonder, how does the PIT count fit into the larger homelessness data picture? This graphic presents the population experiencing homelessness from the most exclusive list in the center, smallest circle, to the most inclusive in the largest circle. So let's start with the smallest circle here, the priority list. This includes data on clients who have given consent to be identified on a list, they've been assessed, and they're ready to be matched to housing. In the next circle, we add the rest of the folks who are in coordinated access. They're interested in connecting with services, but the type of services they require may not yet be well defined. For communities who carry out a registry week, the subsequent circle includes clients with whom you've connected during that registry week. They've given consent to share information, but they still may need to complete assessments. The next larger circle is known homelessness, and this is who is included in a point-in-time count. Keep in mind that the PIT count aims to include absolutely everyone experiencing homelessness in a community that can be reached on the day of the count, but does not include all folks experiencing homelessness in a community over time. The largest or outer circle of this image includes all homelessness. There's no 100% perfect or complete way to measure this. This graphic highlights some of the differences between PIT data and other data in the homelessness sector, and shows how these data complement each other. PIT data is anonymous and static, and is typically collected every other year. Its collection is not part of day-to-day service delivery. It attempts to include a wider slice of homelessness, but only on that one day. By name lists aim to include everyone experiencing homelessness in a community over time, but is limited by the fact that the data is identified, and not all clients want to be on such a list. It's also limited by how much time a community dedicates to keeping it up to date. As you know, individuals move in and out of homelessness in your communities every day, so keeping this list up to date can be a lot of work. Shelter data provide good information about lengths of stay as well as demographics. However, it doesn't include those who don't use shelters. In the 2018 national PIT count, 25% of survey respondents indicated that they hadn't used an emergency shelter in the year prior. Then we have program results data. These data highlight the successes of specific programs and help to define best practices. They focus on program level data rather than client level data. These are just a few examples of the data universe that are used in planning, policy development, and service delivery. at the local, provincial, and federal levels. Hopefully this helped to situate the point-in-time count data. So this is the very brief history of the nationally coordinated point-in-time count. A few communities in Canada have been conducting counts since the early 90s. However, by 2014, only 16 communities had ever conducted a count. The federal government sought to align methodologies and expand the count coverage in order to create a more complete picture of homelessness in Canada. The first nationally coordinated count took place in 2016, and 32 communities participated. Those are indicated on this map by green dots. The second coordinated count took place in 2018, and 29 additional communities joined. Those communities are indicated on the map in purple. The third coordinated point-in-time count was set to take place in March and April of 2020. But like most everything else in our lives, COVID threw a wrench in those plans. Some communities were able to complete their counts before the pandemic was declared and public health safety measures were enacted, but most had to postpone. We developed a number of modifications to the point-in-time count methodology to enable communities to carry out counts safely during the pandemic. These modifications took into account health and safety, as well as the increased strain on staff in the sector. These are just a few of the modifications that were offered. So one, changes were made so that communities could proceed without volunteers. Next, we provided the option to fully separate the enumeration from the survey by months if needed. And we also allowed flexibility to administer the surveys over a longer period of time. Despite all the challenges presented by the pandemic, many communities adopted these changes and successfully conducted a count this year. So this chart shows the progress of the 2020 to 2022 counts. It's up to date as of October 22nd. So we'll start at the top of the pie chart and go clockwise. So 9 communities completed a count in 2020. 19 more completed their counts this past spring. 4 have completed their count this fall so far, and 15 more are expected to complete them this fall. The final 18 communities have postponed their counts to spring of 2022. So before we move on to possibilities for the future of PIT counts, I wanted to lay out some of their strengths so that we're all on the same page. First, alignment. Point-in-time counts are a well-established methodology and are conducted in communities around the world. The Canadian nationally coordinated method, including the core elements, core populations, and core survey questions, has been adopted by 66 communities across the country. Dozens of Canadian-specific resources, including a guide, a toolkit, training videos, and presentations, have been developed to support communities in carrying out successful counts. This alignment enables us to roll up data across the country to paint a nationwide picture of homelessness. The count also enables us to measure the changes in homelessness over time, because the same methods are used from one count to the next. It allows us to measure changes in homelessness, both in the number of Canadians experiencing homelessness and also how demographics change over time. So another strength is in the enumeration element. A core piece of the count is enumerating the unsheltered population. Outside of the counts, this population is not often measured in a comprehensive or complete way. Data from the count also allows us to see how homelessness is changing across the country closer to real time, because we're able to collect and analyze the data more quickly than, say, shelter data. So next are some of the strengths of the survey. So the survey collects information that's not routinely collected elsewhere. I touched on a few of these earlier, but some of the data that's not collected elsewhere in a consistent way across the country is experience with the child welfare system, racial identity, sexual orientation and gender identity, and others. The survey questions were developed in partnership with subject matter experts and communities over years to fill data gaps. The survey also includes hard-to-reach populations. This is central to the methodology of the count. This enables collection of data from some individuals who don't usually access services. We have some of these data points for many clients in other databases, but for people who don't access services, we just don't have that much information elsewhere. Another strength is the comprehensiveness of point-in-time counts. Counts include individuals staying in violence against women shelters, transitional housing, and many communities also include folks staying in health, treatment, and correctional facilities. Counts also include all programs in a community, regardless of funding source. This can help to strengthen ties between organizations in a community. Lastly, it collects these unique data points that can't really be collected during regular service delivery, whether it's that there's not enough time to collect that information, or maybe that data collection environment doesn't provide enough privacy. So despite all the aforementioned strengths, there are absolutely limitations of point-in-time counts. First, they're labor intensive to plan and carry out, and they're not part of day-to-day service delivery. On top of that, some communities do multiple events that go hand in hand with their count, like magnet events or registry weeks, and that adds to the planning. And as you know, resources are often stretched thin in the sector. Recruiting, training, and managing a large number of volunteers can also be very time-consuming. Then there's no question in the core survey that explicitly asks about what services a client may need, so we may miss opportunities to connect clients with services. Many communities may collect much of the information in the survey already, so are we duplicating efforts? We've already touched on the stretched resources in the sector. Depending on the community, hidden homelessness may account for a large portion of folks who access services and require housing support. And there are two challenges with hidden homelessness and the PIT count. While some communities do work to include hidden homelessness in their counts, it's not a part of the core methodology, and PIT counts are not designed to capture this group. So many individuals experiencing hidden homelessness in Canada are missed in the national count. On top of that, the methods employed by different communities are not standardized across the country, and so we can't roll those numbers up nationally. The PIT count may understate the need for services in a community, especially when the inflows and outflows are not well understood. Of course, the number of individuals who are experiencing homelessness in a community over the course of a month or a year is a very different number from a one-night count. That difference can be challenging to explain to policymakers, media, and donors. For anyone who's participated in an account, you'll know that it is often less than ideal data collection environment. Late at night, out on the street in the dark, sometimes freezing cold. And that relates to the last item on this slide, which is that variables like weather that are totally out of our control can affect enumeration from year to year. And techniques of individual surveyors who might be volunteers and unfamiliar with this population can affect the numbers and the data. So what comes next? How can we improve the data collection method? A few things to consider. How can we improve the quality of the data that's collected? Can we improve the conditions in which it's collected? Can we improve the human element? How can we lessen the burden of collecting this data, and what's the most efficient way to collect it? How frequently should we enumerate? Can we fill this gap more frequently and reduce the margin of error on our counts? How frequently should we survey? Can we survey less frequently? How can we do all of this while maintaining the alignment that we've built and still collect all the critical data points that are unique to the PIT survey? So for future possibilities, we could further separate the enumeration and the survey portions of the count, as was started this year. We could enumerate annually, utilizing only outreach teams for the unsheltered enumeration. The sheltered enumeration portion would continue to be pulled from administrative data in all programs. We could reduce the frequency of surveying to once every 3 years. Can we better integrate collection of these data into day-to-day work? If we integrated the PIT count module into the main body of HIFIS so that it's linked to identified client data, this data could be collected over a much longer period of time and can be used by programs in service planning. This could also reduce redundancies with other data collection. Other possible improvements center on increasing the value of PIT data. We've heard that communities could benefit from the development of tools to analyze their data and more easily share findings. Pit counts collect a massive amount of data, and that data has a lot of untapped potential. Enabling communities to link the data from the pit questions to other data they have on clients, with client consent, of course, would allow for more analysis. Would communities agree to a more open data sharing agreement so that researchers and others could analyze and utilize these data to a greater extent? As I mentioned at the start, this revamping of pit counts is a work in progress, and I would love to hear your suggestions on ways to improve the pit count. Do you have a suggestion for ways to improve? Thank you so much for your time, and I'm excited to hear your feedback and suggestions.